You remember what it was like. And to be honest, Dr. Wood, I know what you're talking about, but at the same time, I don't know if it's really as relevant to most of what we do. If someone has diabetic retinopathy, they need to change their diabetes control and get laser therapy. If they have glaucoma, they need to use regular drops and administer them properly. And if they have a corneal ulcer, I'm going to make them use Tobrex every hour. I understand the value in somewhere like oncology or geriatrics, but there's a reason we didn't choose those specialties, right?
Actually, Lauren, I completely disagree with you. I think that what we do is very holistic medicine with significant impacts for our patients, and they deserve our respect and our time. Now, do you disagree with that?
No, but that's not what I meant.
Really? Because it also seems like you're being quite disrespectful of your patients and of their ability to make their own decisions.
Well, sometimes they can't, and my job is to limit poor outcome.
Is that how you see your patients as outcomes?
Well, no, of course not. But at this point, like I said, it's not like I have much of a relationship with my patients. And the few times I've tried to chat more, I run over time and end up in trouble with the staff. And there's so much pressure to answer all the questions correctly, to come up with the right treatments, to get the procedure right. It's not like I have time to spend. Do I?
Well, Lauren, look, I completely understand how you feel. I remember when I was training, I felt much the same way. I'm not trying to say that it's easy, and I appreciate the competing needs, and that you may not feel encouraged to do this on the ward. I mean, it's a whole other issue we need to deal with. No, I don't mean you. When I say we, I mean the senior executive. What I'm trying to say, though, is that communicating well with your patients is very important. Your comment earlier about the college not prioritising it, well, that's not actually true. I mean, I think if you look at the attributes on the form, you'll see that communication is considered to be an essential clinical skill by the college and by myself.
So what do I have to do?
Well, to be honest, I can't make you do anything. Yes, I can send you to 100 workshops, or then you can sit and watch people communicate for hours, but unless you think it's worth learning about, then you'll just be wasting your time. You might as well be studying up on the latest surgical literature, eh? So, why do you think that patient-centered communication and building relationships is worth learning about? That's okay. Did you hear about the retinopathy patient that came into clinic last week? She'd been recommended for treatment a little while ago, but didn't come back.
Yeah, that was terrible. What was she thinking? She's blind in her left eye now, right?
Yeah, she is. Actually, she was my patient. I lost track of the fact that I hadn't seen her for a while, and I was away the last time she was seen by the team, so they didn't know that she's the carer for her husband and her son, who has a cognitive impairment, and that they live on a pension, and she didn't think that she could afford the treatment, nor did they know that she has a needle phobia, and that it's taken a huge effort by Dr. Chu, her endocrinologist, and myself to even get her to take insulin, much less to have a needle in the eyeball.
Oh, that is so stupid. I mean, I guess it's not stupid, but it's not your fault. It's whoever saw her while you were away.
I choose to be a supervisor, Lauren, because, well, I get really excited by the future of medicine. You know, you'll be doing one day things that I could only ever dream of. and part of my role is to prepare you for that. I'd actually be negligent if I didn't try and help you to understand the importance of the doctor-patient relationship and give you the skills to be able to improve that. And, in fact, it's relevant to at least 5 of the key areas that we look out for. Now, I'd be failing you. I'd be failing to help you become the great clinician you can be, and putting your outcomes at risk.
Right. Thanks.
So, if you like, we can book you in for another communications workshop, and I wonder how you'd feel if I had a chat with Dr. James. I know Keith quite well. He's your next supervision rotation, isn't he?
I don't want him to think I can't communicate, because I can. I'm generally pretty good.
It's more about explaining to Keith that this is a priority area for you, that you think it's important.
Yeah. That'd be good. And I'd like to do the workshop.
Yeah? Great. Is there anything else?
I know I'm finishing up with you, but would you have time to chat about this again? Only if you're not too busy.
Of course, Lauren. I'd be delighted to chat anytime you need.
How would you characterise the strategy the consultant used here? Do you think it worked? Can you identify 2 responses from the supervisor that you thought were most effective? How did the trainee react to this approach? Who mostly controlled this interaction?